At last year's conference, we spent a lot of time talking about bad management programs that blame workers for their injuries, that ignore hazards, that punish workers who report dangerous conditions. At one point, a management representative, a pretty good guy, came up to me and said, "Okay, we get it. We know what you're against, but what are you for? What is it that the union wants?" Well, nobody ever answered that question better than Samuel L. Gompers, first president of the AFL, who 98 years ago said, "We want more schoolhouses and less jails, more books and less arsenals, more learning and less vice, more leisure and less greed, more justice and less revenge." He didn't say anything about health and safety in that famous quote, but he could have. And if he had, it might have been something like this. He might have said, "We want more health and less disease, more safety and fewer injuries, more opportunity to determine our own working conditions, more union power in the workplace, more power to protect ourselves and to protect our fellow workers." That's the vision. But a vision needs to be filled out with a specific program and a plan and a strategy. What we need is a comprehensive, union-based safety and health program, flexible enough for every workplace, of every size, in every industry, but detailed enough to give clear guidance. It has to be effective, and it has to be practical. It has to be something we can fight for and win. Most of all, it has to respect the knowledge, the skill, the dedication of our members and the role of the union. And it has to work. Those of us in the USW Health, Safety, and Environment Department of the Tony Mazzocchi Center have been working on this for a while now. Like all such long-term projects, it sort of comes and goes in starts and fits. Our day job is assisting local unions, responding to accidents, working on standards and legislation, facilitating education programs. So we get to this when we can, even though it's probably the most important single thing that we're working on. Why are we doing it? Because nobody else is. Well, there are plenty of vendors out there who'll sell you a safety and health program. DuPont Stops, Safe Start, Human Performance, Fred Ryan Associates. A lot of you have experienced some of those programs. There are about 100 others. Some of them are actually harmful. Others have some good elements, but not many good elements. Many of them are gimmicky, because that's what sells. None of them recognizes the union's role. Some unions have written excellent partial programs, including our own. The best of those is TOP, the Triangle of Prevention Program, which was first established by the oil, chemical, and atomic workers, which of course is now part of our merged union. The TOP reps at the conference will be the first to tell you that TOP isn't a complete program, but the concepts pioneered by TOP will surely be part of our expanded program. And incidentally, if you'd like to know more about TOP, there are workshops tomorrow and on Wednesday, and the TOP reps at the conference will be glad to explain it to you and maybe enlist your company. Our goal is to roll out a comprehensive USW safety and health program in 2014, hopefully by the time of the August International Convention. But for that, we need your help. We can't do this right without help from the safety activists throughout the union. So we'll be asking for your input along the way. You know, there are only 23 of us who work in the Safety and Health Department and in the Tony Mazzocchi Center. There are thousands of steelworker safety and health activists across the union. Collectively, we investigate, sadly, more fatal accidents, more serious accidents, more accidents in general, more near misses than probably any other institution in North America. Collectively, we have an enormous amount of knowledge, enormous experience, and all of that experience needs to be brought to bear in creating this program. That's what it'll make it a good program. We'll have a lot more to say about it in a couple of workshops that will begin Thursday afternoon over at the Westin. So anybody who wants to be directly involved at this stage, please come to those workshops and give us your ideas. But you don't have to come to the workshops to give us your ideas. Call us in Pittsburgh, talk to us anytime during the conference, anytime after the conference. We'll be rolling out parts of the program for comment, for review to our local unions before they're finalized. We really need your input. Here's a little of what we've been thinking about. First, we think the union should have two goals for a health and safety program. The first is to create safer and more healthy workplaces. Pretty obvious. But second, and equally important, we want a good safety and health program because it creates a stronger union. Now, that second goal startles some people. They think it's somehow illegitimate, that the only goal of a safety and health program should be safety and health. But how many times have you heard a CEO or a manager say, we think health and safety is critically important because it makes us a stronger company? How often have you heard them say, we value safety because people are our most important resource? Think about that for a minute. You're not a human being, you're a resource for the company. In other words, they think safety and health makes them a stronger company. And when they say those things, they get applauded. So why can't we say that one of our goals is a stronger union? In fact, you really can't have one of those goals without the other. If you do safety right, you're going to be building the union. You're going to be talking to people. You're going to be asking people, what are your issues? What are your problems? What makes this job unsafe? What worries you? How can we work together to fix it? That builds the union. You can't build the union without taking on all the things that threaten membership. And you can't really do safety and health right without a strong union. So it's really the same goal. Second, we think the preeminent focus of a health and safety program ought to be to find and fix hazards. Things like unguarded machinery, toxic chemical exposures, the possibility of explosive vapors. We think you do that by first gaining a detailed understanding of the workplace and the production process, and then applying a lot of tools. Hazard mapping to begin with, and there are workshops at the conference on hazard mapping, and then a rigorous audit program that looks for all the things that can go wrong or are going wrong and can thereby cause an injury. You know, for years and years, we have done safety by having the safety committee do a monthly walk around, and that's good, that helps. But one of the problems with that is illustrated by a study we did in the union about 10 years ago. We looked at a bunch of fatalities, and we asked, would a walk around have seen the things that caused this fatality? And you know what? In half the situations, it wouldn't. And the reason for that is that people often get killed when something goes wrong, when something breaks. It's 3 a.m. Piece of machinery breaks. They need the production. They throw 6 maintenance workers at it. In a poorly planned operation, something goes wrong and somebody dies. That's a typical fatality. Walk-arounds won't see those. You need a different process, an audit process, a process that involves not only a safety committee, but the workers who are actually going to be asked to do that job. We're going to call this program, at least tentatively, Looking for Trouble. Because if we don't find trouble through a workplace audit, trouble will surely find us, and somebody's going to get injured or killed. We are, of course, open to other suggestions. If you think there's a better title, we'd like to hear it. Everything is up in the air at this point. But it is a lot catchier than a USW Model Comprehensive Health and Safety Program. And it pretty much sums up what we need to be doing. Third, you also need a good program for investigating accidents, near misses, process upsets. That way you can learn what went wrong and what could go wrong in the future. It's something that the USW TOP program, the Triangle Prevention Program I mentioned earlier, does so well. It's the basis of that program. Because you need to investigate all injuries, accidents, near misses, upsets, it stands to reason you want all of them to be reported. Therefore, we are against programs and policies and procedures that reward workers for not reporting such events or punishes them for doing so. We're going to talk a lot about positive and negative, quote, incentive programs at this conference, programs where workers get disciplined for violating a work rule that's meaningless, like eyes on task, or never enforced until there's an injury. Programs where everybody involved in an accident gets drug tested, regardless of whether they had anything to do with causing the accident. Just innocent bystanders, or so-called positive incentive programs where you get a jacket or a pizza, or a raffle ticket if you don't report an injury. First, they don't work. Second, they're insulting. If you think about it, their message to workers is, their message to us is, we think you're too dumb to care about safety unless we bribe you. It's not the kind of program we want. Doesn't mean we're against a war. Doesn't mean we're against rewards. But give them for the best safety suggestion or the best performance on an audit. We're going to give a lot of awards to outstanding local unions at this conference. We're not going to give any based on injury rates. You'll hear a lot at this conference about behavioral safety, about programs that focus on telling individual workers how to behave in a hazardous workplace. We have a problem with behavioral safety. First, we think it's a cheap way to avoid doing what really needs to be done, finding and fixing hazards. And it doesn't really work. Do we teach people to tiptoe through the minefield, or do we clear the mines? In addition, we don't much like the word behavior. Oh, it sounds very professional, social science-y, but it immediately sets up a negative impression. Remember when we were kids and, mom and dad said, son, daughter, I'd like to talk about your behavior. It was never a good thing. If behavioral safety proponents knew anything about behavioral psychology, they'd know enough not to use words that turn people off. And that brings me to the biggest problem with behavioral safety. It sends workers the message that they are the problem. And we are never going to make progress until we understand that workers are the solution. We will never succeed with any program that does not enlist the skill, the knowledge, the dedication of the entire workforce. How can any program succeed if it starts by blaming the very people who are essential to its success? Okay, we're against behavioral safety, but that doesn't mean we don't care about how people do their jobs. Of course not. We want people to work as safely as possible. We think the way to do that is to attack the things that make it hard to work safely. Things like fatigue due to excessive involuntary overtime, poor training, poor instrumentation, excessive or conflicting job demands. We have to make it possible to do the job safely. A few years ago, we did a major survey in 4 steel plants. We asked people, have you ever done an unsafe job knowing it was unsafe? You know what? More than half said yes. And then we asked why. 60% said there was no other way to do the job except to do it unsafely. That's a hell of a finding. It means we either haven't found a way to make those jobs safe or we haven't communicated it. We're going to start from the assumption that people want to do their jobs safely and well. And it's our job to help them do that by removing the impediments to doing jobs safely and well. We have to remember that we're all human. We will sometimes be tired, distracted, confused, preoccupied, clumsy. We can reduce mistakes to a minimum, and we should, but there will still be mistakes. We have to create workplaces that forgive the occasional mistake. We've all heard the word fail-safe. Fail-safe doesn't mean the system can't fail. It means that when it fails safely. The power provided to an elevator holds the brakes open. If the power fails, the brakes slam shut and the elevator stops. That's a fail-safe system. We need to create workplaces where things, when they fail safely, because systems do fail. Equipment fails, people fail. We can't make every system fail-safe, but we can do a lot better than we're doing now. And that should be a goal of every safety program, and that will be one of the elements of ours. One of the things we have to talk about, frankly, is discipline. A lot of companies think the way to reduce mistakes is to discipline everybody who makes one. If they're serious about that, pretty soon they haven't got a workforce left, because everybody makes mistakes. We need to investigate mistakes. We need to find out where they occur. We need to address their causes. We don't need to drive them underground through heavy discipline where nobody risks reporting them because they don't want to be punished. There is a place for discipline. Where an accident occurs due to malicious intent, outright or knowing defiance of a real safety rule, properly communicated, utter recklessness. But I don't think that happens very often. You can't discipline your way to safety. A few more things. We believe that every local union and every unit in an amalgamated local should have a joint safety and health committee. We believe that the union members of that committee should constitute a union-only safety committee and meet on their own at least as often as they meet with a company to set goals, to plan strategy. Having a joint safety and health committee that only meets as a joint safety and health committee where the union members never meet on their own is like having a union bargaining committee that includes members of management. Not something you especially want to do. We think strong contract language is essential to union and member rights and to safety and health, and our program will have recommended language. We have to bargain good contracts, but bargaining doesn't just happen at contract time. Every time we discuss a grievance or a safety issue or a company or a union proposal, it's a form of bargaining. So our program will embody a concept called continuous bargaining. More than anything, the program is going to be based on our strong belief that workers and unions should have a role, should have a voice, should have power, should participate fully in the work of making jobs safe. We believe that's essential to the job of safety and health. But even more fundamentally, we believe it's a matter of basic human rights. Well, that's the 30,000-foot view. But like the trailer says, look for it in 2014. But don't just look for it. Help us develop it.